Good morning, presenter.
Yes. Okay, so straight away, yes, it's one-on-one with LASHMA. For our listeners that perhaps are not familiar with our numbers, I know a few people, they will tell you, no, is that 0809 I want? Yes, so the 0809 is back and better, fully operational. So 08099120777. Yes, that line is back. So it's not just for WhatsApp. You can call that line. I definitely will be here to pick up your calls. 08099120777. You can also call 091-538-77127. That is 080 okay, this is 091-538-77127. Those are the two lines that you can call. Of course, you can also send a WhatsApp message to 00991-20777. All right, Mr. Omotayo, for the benefit of first-time listeners, and for those who perhaps do not have a clear grasp of what we're talking about, what's all this gibberish that people are talking about? ILERA EKO, what's ILERA EKO? What exactly is it all about? As surprising as this might sound, there are people in Lagos who do not know what we're talking about. Yes. So let's do a bit of classroom work. What is ILERA EKO? Okay, thank you very much.
ILERA EKO is a social health insurance scheme for people living in Lagos State. It's an initiated program from Lagos State government, and it's a subsidized health insurance scheme for everybody living in Lagos State to key into this scheme to enjoy what Lagos State have started since some years back. Government realized people pay much in their various hospitals whenever they're having health issues. So that is why this ILERA EKO it's being brought to our doorsteps. Now everybody in Lagos State should key into this ILERA EKO. It's a very subsidized health insurance scheme for everybody. That it's a scheme that we can afford. Yes. So it's helped to reduce the financial burden in our various hospitals. It even increased our self-esteem. It reduced depression and anxiety. Sometimes when someone don't have money and you are sick, you want to visit hospitals. But under this ILERA EKO, once you register, you pay a token of money, you are good to go to access care in your various hospitals.
Without that anxiety, because the truth is nobody plans to fall ill, but when it happens, that running helter-skelter, that uncertainty, that fear, that frustration, so I understand you saying it helps self-esteem. The fact that you have some sort of safety net to fall back on, it makes a whole lot of sense. So all through this month, we have been doing, a bit of exposition on the different plans that we have available under ILERA EKO. So let's just also do a bit of revision. Please tell our listeners what these plans are, and let's talk about the cost implication.
Okay, under this scheme, we have different plans.
Yes.
The common one that we all know is Standard Jara.
Standard Jara plan.
Standard Jara. So Standard Jara for a single or person is 15,000 naira. Individual. Maybe I'm single, 15,000 naira. So family of 4, which is father, mother, and 2 children. The children from age 0 to 23 is 55,000 naira.
55,000 naira
for
an entire year.
Full year calendar, yes.
Okay.
So family of 5, family of 6, they are in the same category.
Okay.
So they are 80,000 naira in a year.
80,000 naira.
So
family of 6.
Yes.
Okay.
So we have another plan that we call Standard Jara Plus.
Yes.
It's just the senior brother to Standard Jara.
Okay.
So that one is for a single person is 40,000 naira in a year.
So we get this question a lot.
Okay.
Standard Jara Plus. Jara in itself is a plus. Jara is physical.
It's just like
you
buy tomato.
Plus.
You buy tomato.
Yes.
And I put Jara for you. Now Standard Jara Plus is now I put the times 2 of that Jara
on top.
I give to you. So that one costs Standard Jara Plus.
Okay.
It's senior brother to Standard Jara. Yes. So we have Standard Jara Plus. So individual is 40,000 naira.
Yes.
So family of 4 is 146. Okay. So family of 5, family of 6, 220.
Okay.
So we have senior plan for senior citizens, 60 years and above.
Yes.
So their health issue, we need to take care of their health issue, their drugs, refilling of drugs, and their own. So when
you get to that certain age, there's some particular illness that you might be susceptible to.
Yes, coming frequently. So their own scheme is 60,000 naira individual.
Okay.
So husband and wife 100,000.
60,000
for individual. So if you are coming on board
mommy
as
and
husband,
daddy,
yes, 100,000.
So there's like some sort of subsidy.
Yeah, we subsidize it to 100,000.
100,000.
Yes.
Okay, as against 120.
Yeah,
that it should have
you
been.
get it.
Okay, a great one. Okay, so those are just the 3 plans we have for now.
Yes, for now.
Okay. So for these plans, what are some of the benefits that people get to enjoy when they enroll on any of these plans?
Okay, we have different. Like I said,
yes,
this Sada Jara is very from Sada Plus.
Yes.
Though they are in the same category, but we have something that's added to Sada Jara Plus. Now, like your registration in hospital, your consultation, scheduled illness, malaria, typhoid, all those things are covered. Your drugs, even BP, testing your BP, your sugar level, all those things are covered under the scheme. You can go there, just walk to the hospital. I want to do my BP. Some people, they don't check their BP until they are sick. You understand? Because of maybe they will go to the hospital and pay. But under this scheme, once you're under this scheme, you can walk to the hospital any day and check your BP. You can see specialists, almost 8 specialists. Your gynecologist, your general surgeon, your physician, pediatrician, and some other specialists you can see under this scheme. So we have under your dental care, your scaling and polishing, tooth extraction, 2 per year, composite filling. So you can do that under the scheme. Your eye surgery, maybe you have something swell up in your eye, we call it pterygium surgery. So we can do that. And cataract surgery. Some people feel of cataracts. We have that common now in Nigeria. So cataract. So under the scheme, it is covered. You can do the surgery. Okay. So and some other things, ECG, cardiogram, and some other payments. Okay. You can benefit from that one. And that's Standard Plus. I call it senior brother of Sada Jara.
Yes.
The reason is because we added, if you can view the money, the premium is even different. It's too so you can see it. So it's just a senior brother. We upgraded it to Sada Plus, so that people, if you said, okay, I don't want this, you have to buy this. So Sada Plus, like admission in your hospital, in Sada Jara is 15 days. In this Sada Plus is 21 days.
21 days.
You can see the difference.
Okay.
The ward in Sada Jara is general ward. In Standard Plus is semi-private. Okay. So those are the difference in there. Okay. So in senior plan, like mammogram, like post-rate antigen for men, it's under this scheme, it's covered. It's also covered in Standard Plus. So those are the difference, just the two difference. So when they are ready, you just go to our places, go and register, or you just call us. So you have to.
Okay, so I have a question here. This person just this is Tokumbo from Lagos. So from this question, this one is good morning LTR. Please, is fibroid surgery covered by ILERA EKO?
No.
Okay.
No.
So fibroid surgery is not covered.
No, we are work in progress.
Yes.
So we are still working on that. Maybe by next year, they might bring it on board. So
that's something you need to work on.
Yes. We are work in progress. So.
But how about the other surgeries covered?
Yes. Other surgeries like hernia surgery.
Hernia, okay.
Yes. Appendicitis, appendix surgery.
Appendix, okay. Simple surgeries.
Simple surgery, so those are covered.
Although the truth is, in healthcare, no surgery is simple. But the severity, let's just put it that way.
Cervical cyclage for women, so all those things are covered. How many surgeries that are covered under this?
That are covered, but fibroid for now is not covered. Could there be a particular reason why it's not covered for now?
I don't know, but I know. Like I said, we are work in progress.
Yes.
So maybe later they will add it to it.
Okay.
So we review our benefit package every year. So
of course, I know the show is being monitored. Yes. So and you also take the feedback. So let's see how this can maybe put in one of the plans, even if it means being at an extra cost. Because I know there are some surgeries, even the when it's not normal delivery, when CS is covered, and I know CS is also a bit pricey when you go to maybe private hospital. So if CS can be covered, fibroid should be, considered on this.
We are working progress, like I said. So I know very soon that one may be breathing. But for now, it's not covered.
All right. So we've been able to, touch on the benefit and let people know what they get to enjoy being on any of this. Okay. Now with the prices you called, even though they look very, very affordable, I just want us to, just talk about the consideration that you as LASHMA as an organization have for those who perhaps might not be able to pay this entire sum in full. Is there an opportunity to pay in bits or in parts, or where in a case where residents cannot pay in full?
Okay. We have a
or enrollees, sorry.
Yes. We have a package for that. That what we call ILERA
Cooperative.
It's a cooperative.
Okay.
Under ILERA EKO.
Right.
You get that?
Yes.
ILERA cooperative. So when you come on board on that cooperative, so you'll be paying monthly. You have
instead of the yearly.
You have cooperative money. You still have your health insurance.
Of course, those who were around last week, we actually talked about this in detail. ILERA Cooperative. So you pay small. But can we have an idea how much you get to pay? Is that
it depends. Individual is 4-5.
4-5. Yes. Okay, in that 4-5, your cooperative money is part of it. Then your
health insurance money is part of it.
Okay, so while you're paying for your coverage, you're also getting savings.
Yes.
Which you can also get at the end of the year.
When there is program, you get your money, or you get some other things.
And I know my guest last week also spoke about what you start to get, the other things you start to gain being a part of the ILERA cooperative. Yes,
yes. Some foods or some food stores.
Food stuff. She also spoke. He also spoke about that you being able to access loans.
Yes, under the scheme. Yes, that's what we call cooperative.
Yes.
So you can get loan.
So every other thing you enjoy in other cooperatives, aside the health,
yes,
you get to enjoy here
plus your health.
Yes, so okay. It's a great one.
That's the way you can be paying monthly.
Okay. So now beyond this, still touching on past episodes that we had on the show. There was one we had where we had a guest come up and was able to shine a spotlight on the fact that social health insurance is now mandatory in Lagos because of the the law that was signed. It was signed into law that it's now a mandatory. It's now mandatory that Lagosians, if you live and work in Lagos, you should come on board this. How can Lagos residents register and make payments easily? What's the process?
Okay, like you said, it's mandatory now for everybody living in Lagos State. All residents of Lagos State must key into this scheme.
Yes.
To this social health insurance, Lagos State social health insurance. So, and to register is very simple. We have our kiosks in all our local governments. You get there, you see our agent there, you register. Or we have V-booths across Lagos State. We have in Ketu there, we have in Sabo. So we have V-booths. People are there. So you register, okay. And our office is at Alausa.
Okay.
If you are very close to that place, you can go there. So before I go, I will drop my number.
Okay.
Somebody want to call me, want to register, you have questions, you have something to verify, you call.
Okay. All right, a quick look at the traffic situation. Let's see what's happening at this time. All right, this one is a flash update. Let's talk about this for a bit from the Iba Oto Ijanike axis. First gate inwards journey Iyanoba along Lasu Iba Road. Just showing us what things are looking like around that end, and traffic managers on ground doing the needful. Okay, this was sort of a video, just a video report showing us that the traffic around that end is moving quite smoothly. Traffic managers, I see a strong presence of traffic managers, doing the needful, making sure traffic moves as smoothly as possible. Okay, a bit of a bottleneck, but I see construction activities, but the traffic managers are well, placed there, just making sure things move as smoothly as possible on that stretch of road. Okay, so this is also from the Ikorodu end, where from Olopomeji down to Odogunyo is a smooth one. Approaching Odogunyo is slightly busy due to early morning rush. Further movement in was Flower, second and first gate. Okay, Gbegun, Sawmill, Jubilee, LASHMA Yard. Inwards Sabo proper is good. Sabo inwards Power Line, Aleje. Inwards Ikorodu interchange is also quite encouraging. Ikorodu interchange connecting Primero, Unity all the way to Benson is under control. The return journey inwards the interchange is good to go. Traffic lights, Itamaga inwards Radio, Musical Village Grammar School towards Otauno is good. Otauno connecting Eluku Palace all the way down to Ladiga inwards Ojubode is good. Ojogba inwards Ojogba inwards Ojubode en route the Ikorodu interchange is also good. There was also an update of an overnight impediment, a flat body truck loaded with iron bars, the 4 tires in the drainage, not obstructing traffic, and structures well positioned. Let's see if we can take this call. Let's see what's happening with this. Okay, 08099120777 is the number to call. Hello, good morning.
Hello, good morning.
Yes, who do we
My
have?
name is Andrew.
Andrew, okay, please go on, sir.
Please. I want to ask something on behalf of a friend.
Okay.
He was asking me, the wife works in a government parastatal,
Okay.
and federal government parastatal, and they and the children, they are using the clinic of the parastatal for different type of ailments or whatever.
A federal or a state parastatal?
In federal
Federal
parastatal,
parastatal, okay. Please go.
not military parastatal.
Yes.
Now, the man said it's compulsory for all residents of Lagos.
Yes.
Are they supposed to still register with them, Lagos State National Health Insurance, and they are using that one? Because this thing is somehow confusing. Because I told him, well, you call ILERA EKO, but he's at work now. That's why I'm calling to ask to give him feedback.
Yes, on behalf of him. Okay.
Yes.
All right. Thank you very much. My guest will address this. Thank you so much, Mr. Andrew, for calling in. Do enjoy the rest of your day. I hope you understood the question.
Yes.
Okay.
So what he said is,
and we've been getting that too, because that mandatory
what he said is
clause.
Federal HMO, which is NHI.
Yes.
So they are on that.
Yes.
And it's talking maybe, like I said, that it's mandatory.
Yes.
People live in Lagos State. Yes, they can register as well.
Okay.
But they can be using that NHI without any penalty.
Okay.
But this one, they can also register. You understand? It's different scheme. You understand?
But what he's saying, since it's mandatory,
Yes.
he's saying, so does it mean that it's a must? They must, when they already have this on the federal level.
Once they have that one, they are good to go.
They're good to go.
Yes.
Okay.
But if they don't enjoy that one, they can register this one
Okay.
as well.
I think he's just talking about the fact that since we are underlining the fact that it's mandatory now,
Yes.
which is like mandatory means it's a must.
It's a must. It's mandatory. They are
Okay.
supposed to know about it. People must, but a lot of people that have the federal, so
And we have
that one is okay for them.
Okay. All right. We have an incident report from the Apapa axis. A broken down 40 feet loaded flat body truck having Boris problems at Quick Road in West Treble. The mechanic is already on ground, doing his best to fix it. And we have traffic managers around that end monitoring the axis. No effect on traffic at the moment, but if you're headed in that direction, do watch out for this particular impediment and just make sure just keep moving. Don't cause an obstruction. We have Mr. Idowu Omotayo, sales officer with LASHMA, and today being our open day, we're fielding questions and while still going through a bit of education, helping those people who perhaps do not have a clear grasp of what ILERA EKO is all about. 080-991-20777 is the number you can call or send a WhatsApp message to. You can also call 091-538-77127. Yes, those are the numbers you can call. Okay, so now assuming I'm already on the standard JARA plan, and I heard about the standard JARA Plus, and my plan is still running. Maybe I'm just 6 months into the standard JARA plan, and I want to upgrade. Is there like a possibility for me to upgrade?
Okay. When you are still active in that
standard JARA plan, yes.
And you want to upgrade to standard
JARA Plus.
So you have to finish that premium that year. You have to finish that year without your standard JARA.
Mm-hmm.
So
you cannot just
change. No, you cannot just do that because you are standard JARA, which is maybe you pay 55,000 naira.
Yes.
So you now want to come on board to upgrade it to standard JARA Plus. No, you have to wait and let that year expire. So after that year, you let us understand. We now change you to standard Plus because on our prognosis, it's a different thing.
So in this case, where I just spoke about, I have 6 months. I'm already 6 months into the plan, so I have to do the rest of the 6 months.
Finish that,
and then when it's time to renew,
we now change
just come on board with standard JARA Plus. But still using the same policy number.
Yes.
Okay.
That's what you do.
All right. How about an instance where I'm not I don't want to say happy with the hospital, but where for one reason or the other I need to change my hospital?
Yes.
Is there a possibility for is that?
Yes, you can change your hospital twice in a year.
Twice a year.
Yes. If you are not okay with that hospital and you just beckon onto us. So we give you a link. You fill the link.
Okay, that's the procedure is a link.
Yes.
How about for our mommies and daddies who perhaps are not so tech savvy? They might not be able to do all the.
And we do it for them.
You do it for them.
Yes.
So they come to
we just give them our call center number.
Okay.
That they want to change their to our call center number. They will do that for them.
All right. So let's just have those numbers for those who want to get in touch or for more information. Yes.
The number is many, so I think. Okay. I think we have. Let me just bring out the number.
No problem. So I will try to bring that up. Let's just go for a quick breather. We'll be right back. Stay close. One FM is one-on-one with LASHMA, where we, answer your questions and, address your concerns. Of course, we have Mr. Idowu Omotayo, who is a sales officer with LASHMA. He has been doing his best to, to just shine the light on this particular plan, the ILERA EKO in the entirety of it, all the plans therein, and what you get to benefit being a part of this. And also, we're able to establish that even for those who do not have enough money to, pay for the annual plan, the annual sum you can pay small when you're part of ILERA and Tiwa Cooperative. There are many other things you could also get to enjoy when you are on board with this. Okay, so just before we went for that break, he was going to give us a few numbers that we can reach out to, but this one also came in. Good morning, Eltira. Good morning. Okay, good morning, Traffic Radio, and good morning to your guest. Please, is family planning covered? Because my neighbor went for it, and I think the neighbor was not attended to.
Yes.
So let's talk about this family plan. I know you didn't mention it.
It's not covered.
It's not covered.
But they can educate you.
Okay.
Family planning education. They can educate you on how to do it, but it's not covered. So
okay. Well, is there a reason though? Is there a reason?
Best note to our management.
Okay.
You understand? So,
okay.
And all these things will still be included. Right?
Yeah, work in progress. For now, it's not covered.
Yes.
Okay, great. That has been established. Okay, so let's just for those who want to get in touch for more information after the program, who can they contact? Who can they call? Who can they message? Or where do they go to? Let's just have that.
So for those that want to register, or you have any complaint, or you have anything to verify, maybe I should give my number after the show. So you call me.
Yes.
Or you want to change your hospital, I can be of help. So.
Okay, let's have your number.
My number?
Yes.
Okay, 080
080
30
30
78
78
98
98
66.
66. Let's take it again a bit slower.
080
080
30
30
78
78
98
98
66.
66. Okay. How about any other numbers we could reach out to?
Okay, our call center number.
Okay.
Shall I give it? Okay.
Yes.
080 ask LASHMA 080
yes
02
02
75
75
52
52
74
74
62.
62. Okay.
So we have another one. Can I give?
Yes, please do.
080
080
04
04
53
53
72
72
35
35 6. Okay.
So our WhatsApp number, we have WhatsApp number.
Yeah.
Message.
Let's have it.
070
070
45
45
35
35
82
82
75.
75.
Yes.
Okay, that's just only WhatsApp.
WhatsApp.
So you shouldn't try to call that line.
Just WhatsApp.
Okay. And of course, we know we have the ILERA EKO kiosks all around.
Yes, we have it. We have it all around. We have in the Kosofe local government. We have in all the local governments.
All the local governments.
And
of course, they had
so
office.
We have V-Boots.
Yes, V-Boots.
Yes.
Around where do we have the?
We have in Sabo.
Sabo markets.
K2. Yes.
K2.
We have in Ikorodu.
Ikorodu.
We have in Ikorodu.
Okay.
So we have in different places.
All right. So, and of course, you can also just take a walk to the head office,
yes,
Good Shepherd House,
very close to
right here opposite the Lagos State Secretariat. Okay. A great one. So just before I let you go, what are your parting thoughts to Lagosians as regards ILERA EKO? So
I will just say, my people in Lagos State, please, if you are not registered for this health insurance, this is the right time. Go and register. Don't wait until government is compulsory or compelling you to go and register, because very soon it's just be like LASHMA. If you don't have it, you won't do anything. So you have to go and register. So people should go out now, call us, register yourself. It's just a total of money. So are you good to go?
Okay.
God bless.
Great. Thank you so much for taking time out of your busy schedule to come, educate us, Mr. Omotayo.
Thank you, presenter.
All right. It's been a great time on the show. Just before we conclude, I have this incident report from the K2 axis, K2 bus stop inwards of Jota from mile 12. High capacity BRT bus having gear fault. Right now it's on the service lane inwards of Jota from mile 12, occupying about 50% of the road. The driver has contacted the office for evacuation, and I see that we have traffic managers there, just taking stock and just making sure things move as smoothly as possible. But there's a backlog of traffic. Of course, we know we still have traffic coming inwards Lagos, inwards town. So there is a backlog at this time, has extended all the way back to Ilele and beyond. So if you're headed in that direction, of course, do factor this into your movement. We have come to the end of today's show. As we conclude today's episode of ILERA EKO Extra, remember that health is wealth. Investing in your health is investing in your future. Don't wait until it's too late. Enroll today. Enroll on ILERA EKO today so you can secure a healthier tomorrow for yourself and your loved ones. You can visit the LASHMA website or any of our enrollment centers to learn more. You can also call our hotline. The lines were ruled out earlier for assistance. Of course, a big thank you to Adeyinka Bimwade, Assistant Director, Public Affairs of LASHMA, for her support and collaboration in bringing this episode to life. Thank you for tuning into ILERA EKO on Lagos Traffic Radio 96.1 FM. Until next time, my name is Akan Usen saying stay healthy, stay informed, and bye for now.
Wizard boy, shall I show it on this? Echo way.